Okay, next slide, please. All right, and like I said, my name is Alicia Snetti. I'm originally from New Mexico. I'm in the Navajo Nation, currently reside here in Maryland, and one of the project coordinators on our maternal health projects at the National Indian Health Board. And I'll let Sarah and Liv also introduce themselves.
I can go next. My name's Sarah Price. I'm a public health program manager on our public health team. I've been with the National Indian Health Board for about 5.5 years, and I support our maternal health work as well as some of our work in COVID.
My name is Liv. I am a public health associate with CDC working at NIHB on our maternal health team. Thanks.
Yeah, so enjoy lovely photos. Next slide, please. And so the maternal health team and our projects are under the Public Health Policy and Program Department, or as we call the PHPP team. And I'll just go ahead and read our vision statement, is that we're working together to empower sovereign tribal nations to improve equity, policy, and public health systems that build thriving Native communities now and for the next 7 generations. I think that's a beautiful statement we all came up with and collaborated on. And go ahead on next slide, please. So a brief overview on today's agenda. What we will be discussing on is Sarah Kerrigan will provide an overview of the Hear Her campaign, and then I'll walk us through the funding announcements, more details, and then if anyone has questions, and we'll also be linking our TA technical assistance form in case if you have follow-up questions, and you can reach us on through that system. And go ahead on next slide, please. Okay, so with the Hear Her project, the National Indian Health Board is proud to be partnering with the Centers for Disease and Control and Prevention, also known as CDC, and the HHS Office of Minority Health on a new segment of the Hear Her campaign, and with our goal to amplify the voices of American Indian, Alaska Native people and working to improve the maternal health outcomes. So this funding opportunity is made possible by the U.S. Department of Health and Human Services, HHS, Office Minority Health, and CDC is also part of the National Indian Health Board's Hear Her project. And Sarah Kerrigan, who is with us today, as well, will be providing an overview of the campaign here shortly. And Sarah is one of the leads for this campaign and leading the efforts in developing the newly released materials for American Indian, Alaska Native people that was released in November 2022. And just want to mention that we're very fortunate and honored and grateful for this partnership and working towards improving maternal health outcomes in Indian country. And with that, I'll turn it over to Sarah, who will give us this brief overview of the Hear Her campaign. And then I'll pick up after and walking us through the funding announcement.
Thanks, Alicia.
Of course.
Hello, everybody, and thank you very much for joining today. Just a moment while I share screen on my end here. Okay, can you confirm, can you see my screen here?
Yes.
Yes.
Wonderful. Okay, thank you. Well, thank you for joining today. As Alicia mentioned, my name is Sarah Kerrigan. I'm the lead for CDC's Hear Her campaign. Before we begin, I would like to acknowledge and honor the Creek and Cherokee nations and their people on whose ancestral homelands I'm speaking from today. I'm also very grateful to all of my colleagues at the National Indian Health Board, as well as Delight Satter, Janelle Palacios, and many of you in this virtual room. I see a few familiar names, so thank you to everybody who is engaged as we've been developing these resources and for coming back together today to continue the conversation. There is still so much to be done, but I am proud and humbled to be here with you today to share some of the work that we're doing to hear and talk to American Indian and Alaska Native mothers, their loved ones, and communities. In this presentation, I will share more information about the Hear Her campaign and the resources that we've produced to serve American Indian and Alaska Native communities. As many of you are aware, in August of 2020, we launched the Hear Her campaign to raise awareness of potentially life-threatening warning signs during and after pregnancy and to improve communication between patients and their healthcare providers. It's a priority for us to reach tribal and urban Indian communities with these resources. In partnership with the Office of Minority Health, CDC Foundation, Market Vision, Gray and Gray, and the National Indian Health Board have worked to develop a suite of culturally appropriate resources for American Indian and Alaska Native communities. We've worked to include the voices and perspectives of American Indian and Alaska Native people throughout the development of the campaign, and we will continue to do so as we move forward. I'm grateful to all of the people who've contributed their time, experiences, and expertise to this project, and I'm really excited for the opportunity to work with you to get these resources out into communities. You may already be familiar with the resources we released this past November, but I would like to share a brief overview before Alicia and the team at NIHB go into more detail on the grant opportunity. To start, I'd like to share the PSA.
The circle of life begins with the birth of a child, and that journey begins with pregnancy. People who are pregnant or who have had a baby know their bodies and know when something does not feel right. When they speak, we must listen. Hear her. Learn more at cdc.gov/hearher/AIAN.
Storytelling is the center of this campaign. We were able to produce the stories of 5 American Indian women who experienced pregnancy-related complications. You see their pictures on the screen here: Sarah, Vanessa, Truva, Mona, and Tequila. They shared their experiences with preeclampsia, HELLP syndrome, and postpartum depression, and the importance of sharing your concerns if something feels wrong and getting care immediately. For the sake of time, I won't play their stories right now, but if you haven't already, I encourage you to visit our website to view their stories. We also engaged Michael Jones, an American Indian photographer, to capture culturally relevant photography of American Indian and Alaska Native people. This authentic, diverse photography is featured in the educational resources and across the Hear Her website. In addition to the videos sharing these women's stories, we've produced educational materials to help raise awareness of the urgent maternal warning signs and improve communication between providers and their patients. These materials are housed on the Hear Her website, along with additional context and links to related resources. What you see on this slide is the urgent maternal warning signs poster, which helps to raise awareness of the symptom that could indicate a life-threatening situation. I would like to note, when we did the focus groups to inform the development of these resources, the 2 things that we heard loud and clear were that we needed this balance. We needed to have a space for American Indian and Alaska Native women to share their stories, and we needed this message to be coming from American Indian and Alaska Native people. But we also needed to provide these tangible examples of when it's really important for somebody to get care immediately. So that is one of the things that I think is a strength with this campaign, is that balance of the storytelling and amplifying these voices, but also providing these tangible tools and resources. And this is where I hope that we can work together moving forward to make sure that we're getting these resources into the hands of the people that need them. I would also like to note these resources, the warning signs poster, the conversation guides, the palm cards, and the provider poster will be available to order for free. So you'll be able to order these print materials for distribution in the next week or so. So we'll certainly share that information through NIHB as soon as they're available. We've produced conversation guides and palm cards for people who are pregnant and postpartum to help them share symptoms they experience and raise their concerns with healthcare providers. We also have a handout and palm card aimed to family, friends, and other support people. We know that it can be challenging to talk about complications related to pregnancy. These tools can help facilitate conversations and make sure that people who are pregnant or postpartum get the care that they need. Finally, and most importantly, we have materials designed for healthcare professionals. Healthcare professionals play a critical role in eliminating preventable maternal mortality. And a critical part of that solution is to really hear women's concerns during and after pregnancy. The materials we've developed emphasize the importance of building a relationship with patients, supporting their cultural strengths, and ensuring they feel safe sharing their needs and concerns. We also share information and resources on providing culturally appropriate care. Understanding and respecting the unique needs and cultural practices of each patient is an important part of building trust and providing medical care. We're working to produce more resources for clinicians that center the voices of American Indian and Alaska Native experts, sharing tangible examples of how to practice culturally appropriate care. In addition to the downloadable and print resources, we have a suite of shareable graphics and social media posts for partners like you to amplify the message and help get these resources out to American Indian and Alaska Native communities. All of the resources I've just shown you are available for anyone to use as they are. We're also working on making all of the materials available for co-branding through CDC's State and Local Health Media Center. This is typically utilized by state and local health departments, but can also be utilized for tribes or UIOs to apply tribal seals or logos to the materials. We hope to have these materials in the next few weeks, but we'll definitely have them by the start of the project period for this grant opportunity. On the screen here, you just see a few examples of how other state health departments and organizations have utilized this resource to co-brand Hear Her assets for dissemination. Finally, I'd like to note that the Hear Her website with resources for American Indian and Alaska Native communities are available to host on your own tribal, UIO, or other organization website as a microsite or through content syndication. So this is a way for you to get all of the Hear Her resources and the content that's available on our website on your website with minimal lift. And that way, anytime we update something or we add new resources to the Hear Her website, they automatically come up onto your website so that they're available to the people that you serve. So that's an overview of the resources that we have available that I hope you'll all be able to utilize in your efforts to improve outcomes for American Indian and Alaska Native mothers. These resources have been years in the making, and it's still surreal to me to see them live and out in the world. But this is just the start. Now we need your help to reach the people who need these resources. I'm excited to learn from you about how these resources can be best utilized in the communities that you serve. And my team and I will be with you on this journey to help localize materials, think through implementation plans, or any other way that we can support you. Thank you for being here and for all of the work that you do to improve health and wellness for American Indian and Alaska Native mothers. Now I will turn it back to Alicia.
Thanks, Sarah. I'll just wait for Liv to pull up the slides. And if you guys have any questions during the webinar, we're more than happy to answer it as we go, and feel free to use the chat box. And just switch up the display settings again, Liv.
Yeah, sorry about that.
No worries. It happens. Perfect. Thanks, Liv. And then just go ahead and the next slide, please. Yes, perfect. Okay, so thank you very much, Sarah, for providing the brief overview of what the Hear Her campaign goals and objectives are and what has been done thus far. So overall, the funding opportunity here will work towards supporting and funding tribes and or Native serving organizations efforts in maternal mortality prevention that meet your needs and speak to your own perspectives of maternal health promotion. We just really want to emphasize that we do understand that community members or people working working directly with that community are the experts on what is working best and how to go about addressing maternal health outcomes. And our goal is to support local communities and uplifting maternal mortality prevention capacity. So overall, the funding opportunity is open to those interested in increasing awareness of key actions to support positive maternal health outcomes while using the CDC Hear Her campaign materials. And next slide, please. So these are the three main pieces of the funding announcement that we, NIHB, will be providing up to 3 subawards in amounts of $20,000 each, and that the project period will run from April to July, at the end of July. And just another heads up, that applications are due on March 2nd, 11:59, and I can provide more details later in the presentation. Next slide, please. So we are offering this funding to tribes, tribal organization, consortium of tribes, tribal TECs, and including Native Serving 501(c)(3) organizations and urban Indian organizations, and overall other tribal bodies with public health authority. And applicants, we did put in the application that they have a strong interest and or demonstrated commitment to improving maternal health outcomes in American Indian or Alaska Native communities. And yes, thank you. So for a complete application, these are the main pieces that we are requesting. For Section A is just contact information and point of contacts that we will be working with. For Section B, this will include the application narrative and the scope of work, which will be the project summary. You will share a brief description. We did put 300 words maximum, but the brief description will work as of your project and how it will strengthen efforts and or launch targeted new efforts related to the Hear Her campaign for American Indian and Alaska Native communities. And we'll dive deeper into what proposed projects could include. And so for the award budget section, we are requesting a line item budget with this application as a separate document. And in that section, we provided more information on how payment will be released and including guidelines of what the awards can be used for or what they may not be used for. And, oh, no, stay on that one, Liv. So, and for Section D, as I'm going down, the proposed scope of work, and that's a section where we'll include aspects of your work plan and a timeline. And if you see the application, we did provide a space and examples that you can include as your objectives, expected outcomes, and the different activities that you will develop, and just other sections related to the deadlines, deliverables, and people responsible for the various activities you have developed. And with the signed letter of support should be from the tribal health departments or the organization's director or CEO, the chair of the tribal health committee or tribal chairperson, and if you have any clarifying questions, we will be providing our TA request form in our emails. So if you do have some clarifying questions or anything related to the application, then we're here as a resource. And okay, yes, go ahead. Next slide. And then for this part, well, in the application, we have put it, I'm requesting to have a brief description of what the project can be used for. So we wanted to include some examples here, but not an exhaustive list. Some of the proposed projects could include communication strategy for disseminating the Hear Her campaign resources in your community, whether that's through digital print media, or preparing additional materials that incorporate tribal specific messages or images, and if maybe wanting to hosting local events, workshops, or trainings with people who are pregnant or postpartum and their support networks. And really just any strategies you can identify that would be impactful in your community. And we are excited to see your program's creativity and uniqueness, so we do welcome that. And here I provided some key dates. So thanks for attending the pre-application webinar. Applications are due on March 2nd, and award notifications will be sent out on March 21st. and just having a 2-day turnaround to accept the award. And we'll have a virtual kickoff meeting / orientation on March 30th. And again, the funding period will run from April to July. And we will also link our website where you can find a downloadable Word document, or if you want to request us to send you the document, we're more than happy to do that as well. So again, completed applications are due Tuesday, March 2nd, and that you'll submit the full application packages to my email, eastnetty@nihb.org, and just labeling the subject line 2023 NIHB Hear Her campaign application for tribes. And, you know, from now until then, please use us as a resource. And Sarah Price has linked the TA request form. And we're more than happy to answer any clarifying questions and anything you may need help with in completing that application process. Want to make it an easy process overall. And I'll just open it now if anyone has questions. And I'll read off some questions that we had so far where Sarah Price had answered them, but Emily asks if an entity may apply for up to 3 separate projects of up to $20,000 each. And Sarah clarified that each applicant will apply for one project at $20,000, and that will support up to 3 different applications. So thanks for that, Sarah. And one of the questions were relating to the letter of support. Can the chairperson of the Health Board of Directors sign the letter of support? And that, yes, that would be appropriate. And if you want to go off, explain more of your answer, Sarah, that'd be helpful.
Yeah, absolutely. So we recognize that the public health authority at each tribe and organization is governed differently. So it would just be dependent on how your tribe structures that. If the chairperson of the health board is the appropriate government body, then that would be acceptable to us.
I apologize, I didn't try to clap. I was trying to raise my hand. My name is Allison Mahoney, and I'm with Prevent Child Abuse in North Dakota. We serve multiple tribes across North Dakota. I have the maternal infant early childhood home visiting program at Turtle Mountain. But so as a 501c3, and if I were looking at that and not partnering necessarily with a health consortium, would I need to get at least one tribal programming signature, or like who would that count as?
That's a great question. Sarah, can you provide some more
Yeah,
insight on
absolutely.
this?
So 501c3 organizations that serve Indigenous communities are eligible for this funding. That being said, letters of support can only help to show that you are working directly with the tribes, but you are eligible for funding under this grant opportunity.
So who should that letter come from, I guess is my question, or is it not required? Because I understood it was required.
I apologize. The letter would come from your governing body. So whoever is the governing body for your organization.
Okay.
Yeah, thanks for asking the question. I did provide the link where you can access the downloadable RFA, and also just more information. We'll also post the pre-application webinar recording on this page as well.